Well, welcome everybody. It's nice to see you. I know I can't see most people's faces, but good to see quite a number of you here again. I'm hoping things are feeling a little bit better this week for early year settings. I mean, you can tell us in the chat whether or not you are, but certainly we're seeing case rates of COVID in the sort of 0 to 4 age group coming down, so I am hoping that you're getting some relief. I know it's not a relief for those of you that got outbreaks currently, because once it's in the setting, but overall we should be seeing numbers start to come down now, and I know it's been a really difficult time. I'll just share my screen with you so you can see the latest data. And actually 0 to 4s have come down at a higher rate than any other age group, and some of the age groups have plateaued. Can you see this okay?
Yes, Nadia. Yeah,
can. Lovely. So these are the case rates for the districts and boroughs in Warwickshire at the moment, and you can see they're all heading in the right direction, which is a good thing. So they're all coming down slowly at the moment. What we don't know is how much of this reduction may be due to people just not testing or not reporting their LFTs, which is why it's really important to try and encourage people that are doing LFTs. If they get an LFT positive, they do need to register it online, because that's what triggers all the contact tracing processes, etc. Otherwise, actually, they won't feature in any of the national figures. No contact tracing will be done, etc. So that is really important. But overall, I think things are looking better. Our hospitals are still under a lot of pressure, but we think the hospital admissions have peaked locally as well, which is good. And slowly we're having our care home outbreaks are reducing, which again is a positive thing. So really the message is to keep on keep on with what you're doing. I'll come on to some of the key messages in a minute, but just to show you where we are at the moment. Warwick District is at the top of the West Midlands, so although things are heading in the right direction, we've still got high rates. I have to say we do a lot of testing, as you all know, in Warwickshire as well, so some of that will be reflected in these figures, but certainly we also obviously take it seriously that again we're at that top of the West Midlands League at the moment. So with Warwick and Stratford, actually, so the south of the county being high at the moment, Nuneaton have dropped significantly, Rugby are going down, and North Warwickshire are actually quite low towards the bottom of the pack with Coventry there. So, and I think in terms of key messages, it's the sorts of things that we've talked about over the last couple of weeks, and just getting, not forgetting the basics. So keep up with regular cleaning, particularly those touch points. Ventilation, really important. I'm really hoping for some nicer weather as well, which will make that easier as well. Focus on good hand hygiene, both for children and staff. And also, if you need to try to, if you can, try to minimize mixing between children's groups, particularly when you've got cases as well, and also minimize the amount of time of crossover that you have with different members of staff crossing bubbles, so to speak, and supporting different bubbles, as well as thinking about how you greet the children in the morning and how you hand them back to parents. If it's possible for the staff looking after those children to be doing that rather than your managerial staff, then that's a good thing. A good thing too. Testing, by now our recommendations around testing, so PCR tests for anybody with symptoms, LFT tests just regularly for staff twice a week, and in terms of anybody that's got any of the COVID symptoms, no matter how mild, they must isolate and book a PCR test, and that goes for children and adults. In terms of close contacts, as you know, national advice is to PCR test if you're a household contact, but otherwise not to necessarily need to test. But locally, we say if you can have a PCR test, that's great, and any additional LFT testing that the parents are happy to do as well. Again, we support settings where They've got household contacts of positive cases. If they've got somebody positive in the house and the child is going to a setting, we can ask the parents if they're happy to keep the children at home, but we can't, as we said in previous weeks, enforce it. And indeed, we can't, our local guidance around testing close contacts, again, we can't enforce that either. But anyone with symptoms really should be isolating. Vaccination still really important to keep trying to encourage your staff and any parents. If you're happy to promote to parents as well, then that's great, to make sure that they have their boosters. We know that 2 doses isn't enough for Omicron, and you definitely need your booster, so anything you can do. Think about your vulnerable staff, so pregnant staff, anybody who was previously shielding as well. Is there anything else you can do to reduce risk if you have got spread in your setting, and also any vulnerable children as well? It's very, very tricky. Appreciate it once you've got it circulating. We're expecting a change after half term, potentially in testing advice. At the moment, we haven't had anything down. We haven't had anything down from the national team, but once we do, we will certainly let you know. But as it stands, we're continuing with our current advice. Again, if you do need to close bubbles due to staffing or otherwise, you really just can't operate, then we absolutely understand that, and that's what you need to do. And then just one final thing. In terms of reporting to us, we know that you report on the form, and if you need support, so please don't feel you need to report on the form and report to public health when it comes to just notifying the cases. If you put it on the form, that's great, but if you need support, then it's the early years advisors email address or our public health email address if it's out of hours, if you do need support and advice. So just to say, if you are reporting cases, you only need to do it on the form, but if you want further advice, then it's early years advisors or the DPH admin email address out of hours. So I think that was all I was going to say for now. Unless right, let's have a little look at the. Okay, so I know Michelle is answering some of them as well, so I don't want to duplicate, but just so that others who aren't looking at the chat can hear the questions and answers, I'll just go through them. My chat's just hang on. Okay, right. Please have clarification. Children should be sent for a PCR if they're within their 90-day period. So if they're within the 90-day period, then yes, they should, because they've got new. So if you're in your 90-day period and you've got and you've had COVID, obviously, as you know, you can get it again. So they say don't PCR test within that 90-day period unless you've got symptoms or it's a travel test. So we would say yes, if they're symptomatic, they should PCR test again, absolutely. Then Lydia said, could you advise me if a child had a positive LFT and 24 hours later had negative PCR, then which do you go with? And yeah, the PCR does supersede the LFT, but if the PCR's over 48 hours after the LFT, then it doesn't count. You go with the LFT. If a parent calls saying a child had a positive lateral flow but then presents a negative PCR, do we accept the Friday, Monday? Yeah, do we accept the child in preschool? That's a difficult question, actually, because it does depend. I think because they say it's 2 days, but I think they'll if it's within 40, I will double check that one for you, Westgate, actually, because it does depend with it if it's in the time period. If it's not within the 2-day period, I think they give you 72 hours though rather than 48. But could I just check that one for you? Yeah. Did you accept them? That'd be interesting to hear. Okay, PCR will supersede the LFT. Yeah, if parent says they've posted the PCR yesterday when they're likely to get the result back. Yeah, it does vary. Yeah, within 4 to 7 days. Yeah, I think, as Michelle said, yeah, it can take a little bit longer. Sometimes it comes back quicker than that. I think mine came back in about 3 days, but it can be a bit longer. Yeah. Lydia, do you want to pick up on this? can I just confirm, if a staff member is still testing positive on LFTs on day 10, do they come out of isolation on day 11? So yes, as long as they are, so you can come out of isolation on day 11 if you're still testing positive on day 10, and but as long as you're well and you haven't got a temperature. Okay, that's the key thing. Yeah, if you've got symptoms, you might have a cough that persists, and you might have a change of sense of smell or taste that persists. But if you've got other symptoms, you really shouldn't be de-isolating on day 11. So you've got to be well enough and not have a temperature or other symptoms. PCR test was done on Saturday. Gosh, I'm not following this trail very well. To say. Yeah.
That was Westgate Preschool, so they were saying if the child can the child come back on the Monday.
Yeah, the PCR was done on Saturday. Okay, yeah. Then they should be able to come back. Yeah, I think that's right. Although, I'm still going to double check it, because it's the LFT that will trigger the contact tracing. So I don't know what happens when you have a PCR as well. I'm assuming it must just negate the LFT positive. But yeah, they should be able to. Yeah. Obviously, if the child's not well, I'd keep them off, if they're not well enough to come into the setting, and that's why they've tested, then, they still need to follow the usual illness rules and not come in until they're, 48 hours free of fever, I would say. Do staff still need to LFT straight after having COVID? Yeah, this is a really tricky one, because yes, they should, because I think they just say you can go straight back into your usual testing protocols. And even if you've had COVID in the last 90 days, if you're a close contact, they still and you're doubly vaccinated, they say to do daily LFTs. So you can. I think if people are testing positive, though, right up until they de-isolate, so say they're testing positive on LFTs and until day 10, but they're well enough then on day 11 to de-isolate, they can de-isolate. But I might give them, say, a week's break from LFTs before going back. That's not written down anywhere, but it just seems to be a sensible thing to do. Generally speaking, and most people don't continue to test positive on LFTs. You're more likely to continue testing positive on PCR than you are on LFT, which is why they say you can continue with LFTs. If that makes sense. Yeah. Is that it?
Nadia, can I just check if Lydia is okay? Lydia, because I know we had a conversation earlier. Do you need any? Okay, Mum's emailed the result. Okay, we'll leave it at that then. There was just a bit of confusion on when the child had their LFT and when they'd had the PCR test result.
Okay. Thank
you. Okay.
Are you happy, Lydia? Yeah. You happy? You know what's going on. How are things feeling for you? A bit better? I suppose those coming out of outbreak will say better, and those in the outbreak will say not so good. Yeah. Lydia wants to speak, I think. Can we unmute Lydia? I don't know how to do that.
Let's try, hang on.
Oh, you can now unmute yourself. Oh, there you go. Can you unmute yourself, Lydia?
It's all right, my computer's decided it's not going to play ball.
I think Jessica's done something so that Lydia should be able to unmute herself now. Oh, you can't come off mute, Lydia. No. How do I?
Hang on a minute.
Oh, hang on. I managed to. Actually, Lydia, I think if you did something then, you came off. Please try now. No?
Should we just unmute all and see if that helps?
Yeah. Can you do that?
Trying.
You're not allowing.
Disable mic won't do the job, will it?
No.
Hi Lydia, I've taken you off, so you should just be able to click on the microphone from your side and then
Okay.
be able to speak.
Try now.
I've allowed the camera as well.
Poor Lydia, I'm sorry Lydia for putting you under this pressure.
Oh yeah. Lydia says she's okay, she's sorted now. Okay. All right then, Lydia, but do come back if or if you want to come back either to Sonia or our team about the question. Happy. Brilliant. So is there anything else, colleagues? I don't know how things are feeling for you. As soon as we hear anything about after half term, we'll let you know. But obviously we know you're working through half term anyway. But I think we think that there may be some changes to testing, but exactly what that is, I can't tell you at the moment. Is that okay?
Thank you, Nadia.
Leave it there. Okay.
Okay. And thank you, Michelle, as well. Thanks everyone for coming.
Yeah, thank you all.
Thank you.
Bye.